Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Bowel movement. Introduction. A bowel movement is the last step in the journey of food through your digestive tract when waste is expelled. The waste is made up of what is left after your digestive system absorbs nutrients and fluids from what you eat and drink. It's also called stool or feces. Sometimes a bowel movement isn't normal. Stool may be watery or hard and dry. Other abnormalities can happen. These may be signs of a digestive problem. This program will help you understand bowel movements. It discusses normal bowel movements and abnormal bowel movements, such as constipation or diarrhea. It also covers causes of abnormalities and when to seek medical advice. The digestive system. The digestive system is also known as the gastrointestinal system. This section reviews the structure and function of different parts of the digestive system. Swallowed food passes through the esophagus, also known as the feeding tube, then through the stomach, where it is partially digested. Digested food travels from the stomach to the small intestines, where nutrients are further digested and partially absorbed. The small intestines are divided into three parts: the duodenum, the jejunum, and the ileum. Digested food that has not been absorbed in the small intestines reaches the colon or the large intestines. In the colon, the remaining nutrients get absorbed and stools are formed. The colon is made up of the following parts: the ascending colon, the transverse colon, the descending colon, the sigmoid colon, the rectum, and the anus. Stools are then stored in the last section of the colon, between the sigmoid and the rectum, before being excreted. The digestive or gastrointestinal system is also called the GI tract. It is divided into two parts: the upper GI tract and the lower GI tract. The upper GI tract includes the mouth, esophagus, stomach, and the first part of the small intestines called the duodenum. The lower GI tract includes the rest of the small intestines, large intestines, and anus. Bowel movement. A bowel movement is the last stop in the journey of food through your digestive tract. Stool passes out of the body through the rectum and anus during a bowel movement. The walls of the intestines have muscles that contract and relax to push digested food through. These contractions are also very helpful for having a bowel movement. Intestinal muscle contractions are partially controlled by the nervous system, but also by the food you eat and the hormones in your blood. This is why some people feel the urge to have a bowel movement about an hour after eating. This urge is stronger after meals that are high in fat. Normal bowel function can vary from 3 bowel movements per day to 3 per week. A bowel movement is considered normal if it is well formed, contains no blood, and is easily passed without pain or cramping. Changes in when and how often you have bowel movements are normal. However, if your bowel movements change, you should talk to your healthcare provider. Some changes can be a sign of a more serious digestive problem. The next 2 sections discuss the most common changes in bowel movement: constipation and diarrhea. Almost everyone at some point in their lives will experience these changes.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Constipation. Constipation is defined as having a bowel movement fewer than 3 times per week. Constipation happens when the colon absorbs too much water from digested food. It can also happen if the colon's muscle contractions are slow or sluggish, causing the stool to move through the colon too slowly. With constipation, stools are usually hard, dry, and small in size. This makes stools difficult to pass during a bowel movement. Some people who are constipated find it painful to have a bowel movement. Straining, bloating, and feeling as if the bowel is full are also common symptoms. Some people think they are constipated if they do not have a bowel movement every day. However, it is normal for a person to have bowel movements anywhere from 3 times a day to 3 times a week. Each person is different. Constipation is most commonly seen in pregnant women and adults ages 65 and older. It is also more common in women than in men. Almost everyone experiences constipation at some point in their life. Most constipation is temporary and not serious. Treatment for constipation depends on the cause, how severe the symptoms are, and how long the constipation lasts. However, in most cases, dietary and lifestyle changes will help relieve symptoms. Talk to your healthcare provider about treatment options if you have ongoing constipation. Sometimes constipation can lead to other complications or is a sign of a more serious digestive problem. Diarrhea. Diarrhea means having loose, watery stools more than 3 times in one day. Other symptoms include cramps, bloating, nausea, and an urgent need to have a bowel movement. Diarrhea happens when the body does not absorb enough fluids from the digested food. It can also happen if your digestive system produces extra fluids. Acute diarrhea is diarrhea that lasts a short time. It is a common problem and usually lasts only 1 or 2 days. In general, acute diarrhea is more uncomfortable than it is dangerous. Diarrhea that lasts for at least 4 weeks is called chronic diarrhea. Chronic diarrhea symptoms may be constant or they may come and go. Chronic diarrhea may be dangerous to your health. It could be a sign of a more serious health problem. Diarrhea contains more water and minerals than normal stools. Over time, loose stools may cause fluid and mineral imbalances in the body. To remain healthy, the body must maintain the right balance of fluids and minerals. One of the most common problems caused by diarrhea is dehydration. Dehydration means your body loses more water than it takes in. This prevents the body from carrying out its normal functions. Dehydration causes many problems. Some common problems caused by dehydration include constipation, dizziness or lightheadedness, dry skin, headache, low blood pressure, rapid breathing, rapid heartbeat. To prevent dehydration when you have diarrhea, it is important to drink plenty of water. However, you also need to drink fluids that contain sodium, chloride, and potassium. Many sports drinks contain sodium, chloride, and potassium. If you have chronic diarrhea, talk to a healthcare provider. When left untreated, ongoing diarrhea is not only uncomfortable, it can also be dangerous. Diarrhea is treated by replacing lost fluids, salts, and minerals to prevent dehydration. You may also need medication. Talk to your healthcare provider about your treatment options. Causes of abnormalities. Changes in bowel habits have a number of different possible causes. Often, constipation is caused by lifestyle choices, such as poor diet. For example, a diet low in fiber or high in fats can cause constipation. Constipation may also be caused by dehydration, lack of physical activity, changes in life or routine, such as pregnancy, aging, ignoring the urge to have a bowel movement. There are over 100 different diseases that can cause diarrhea. Most often, diarrhea is caused by a simple viral infection. Bacterial infections can cause more severe cases of diarrhea. Bacterial infections may be the result of eating food or drinking liquids that are contaminated. This is known as food poisoning. Parasites can also cause diarrhea if they settle in the digestive system. These organisms can enter the body through contaminated food or water. Sometimes certain medications can cause bowel changes. Antibiotics can cause diarrhea. Constipation may be caused by antacids that contain aluminum and calcium, antidepressants, blood pressure medications, iron supplements, pain medications. Diarrhea and constipation may also be caused by problems digesting certain foods, diseases that affect the stomach, small intestine, or colon, problems with how the colon functions. When to seek medical advice. It is important to check with your healthcare provider if your bowel habits change. Although an occasional episode of constipation or diarrhea is normal, ongoing changes can be a sign of a more serious problem. If you have constipation, contact a healthcare provider if it does not get better. A healthcare provider will also be able to determine if there is a simple cause to your constipation that can be changed, such as a medication you are taking. If you have diarrhea, contact a healthcare provider if you have any of the following symptoms. Signs of dehydration, including thirst, headache, dry skin, or dizziness. Diarrhea lasting for more than 2 days in adults or 24 hours in children. Severe pain in the abdomen or rectum. A fever of 102 degrees Fahrenheit or higher. Stools containing blood or pus. Stools that are black or look like tar. If children have diarrhea, parents or caregivers should immediately call a healthcare provider for advice. Diarrhea is especially dangerous in newborns and infants. It can lead to severe dehydration in just a day or two. Children can die from dehydration within a day. Other changes in bowel habits may also happen, such as changes in stool color. Abnormal stool colors are any color but brown, including green, white or clay-colored, black, bright red. Sometimes these colors may be caused by the foods you eat. However, you should always contact your healthcare provider if your stool is black or bright red, which can mean there is blood in your stool. Also contact your healthcare provider if you have white or clay-colored stools. This could indicate liver problems and/or an obstruction in the bile duct. Green stools may be caused by diarrhea. Contact your healthcare provider if you are concerned.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. A bowel movement is the last stop in the journey of food through your digestive tract. It is made of what is left after your digestive system absorbs nutrients and fluids from what you eat and drink. Normal bowel function can vary from 3 bowel movements per day to 3 per week. A bowel movement is considered normal if it is well formed, contains no blood, and is easily passed without pain or cramping. Sometimes a bowel movement isn't normal. Diarrhea and constipation, as well as other abnormalities, can happen. Changes in bowel habits have a number of different possible causes. It is important to check with your healthcare provider if your bowel habits change. Although an occasional episode of constipation or diarrhea is normal, ongoing changes can be a sign of a more serious problem.
Thank you for using Explain.